I'm really pleased. It's for years been the white, just elephant, never mind white, just the elephant in the room all the time. When the topic comes up, people smile graciously and move on.
Yeah.
We always just skim the surface. We do not have the courage to look. And that's why I think for us to be informed this morning is going to be a special need that is being addressed in the lives of our principals and our schools and community. And we've got just the man to do it. Dr. King completed his MBCHB at Stellenbosch University. His internship at Hilton-Green Hospital and his community service at Hilton-Green Hospital. During his time at Hilton-Green Hospital, his passion for mental health was discovered, given the high-pressure system at the district service. Dr. King then moved to a contract position at Stickland Hospital for 1 year in the geriatrics unit before he joined the psychiatric unit at Karl Bremer Hospital. Dr. King joined the MEd program at the Faculty of Medicine and Health Sciences at Stellenbosch University in August 2021. And Dr. King hopes to use his interest in mental health to advocate for underserved populations and to increase mental health awareness in the general public. Ladies and gentlemen, Dr. Adrian King.
Good morning, everyone. Thank you so much for the privilege of being able to speak here to such an esteemed audience about a topic that I feel doesn't always get the recognition that it deserves. And I'm also very privileged to be able to speak at an event that my father helped organize, so thank you very much. I've got two disclaimers, or maybe they should be classified as warnings before I start my talk. The first one is that I'm by no means a public speaker by nature or by birth. I'm much more comfortable in my consultation room, one-on-one with the patient, and I'm usually doing the listening, not the speaking. Nonetheless, I'll try my best to fumble over my words too often. And then the second one is a lot of the things that I'll be speaking about today will seem quite basic and quite obvious. But I prefer to use the words fundamental or foundational because oftentimes it's kind of easy to speak about some abstract concepts and philosophize a bit too much. But when you come down to it, it's about the basics that we need to focus on to look after our own health and then also after the mental health of the people that we're serving, namely the kids and the families and the communities. So firstly, I'd like to speak about what health really means. And if we look at the WHO, they've got a definition about health, which is that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But then we have to ask ourselves, what is mental health? So I'd like to read this as well because the WHO has a very nice definition that's quite all-encompassing. And basically it says that mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to the community. So basically it's an integral part of health and well-being that underpins our individual and collective abilities to make decisions, hold relationships, and shape the world that we live in. Mental health is also a basic human right, and it's crucial to personal, community, and socio-economic development across the board. So it's also more than just the absence of mental illness or disorders. It exists on a complex continuum, which basically can be experienced differently from one person to the next, with varying degrees of difficulty and distress, and also potentially very different social and clinical outcomes. So mental health conditions include mental disorders and psychological disabilities, as well as other mental states resulting from significant stress or impairment in functioning or risk of self-harm as well. So people with mental health conditions are also more likely to experience lower levels of mental well-being, but it's not always necessarily the case. I think it's also important in this bit to speak about what mental health and mental health awareness is not. So I think in today's day and age, we are maybe becoming more aware of mental health, and sometimes it feels like it's a bit of a social media trend, where the young people in the classrooms are getting their mental health education from TikTok, from people that are speaking more openly about their mental health concerns, which isn't necessarily the best thing, but at least it's raising awareness and it's starting a conversation. And I think it's important for all of us to be able to be aware of that so that we can take things further and nudge these kids in the right direction. Mental health itself is also not just being overly sensitive or being too weak to be able to get up again and to carry on with your life and just keep functioning. I think that may be how a lot of us were raised and what we've been taught so far, but more and more evidence is mounting that that's not the most optimal way of approaching mental health itself. And in red over there, I've gotten the fact that mental health is not a waste of time, money, or resources, and really is something that needs to be invested in order to reduce the burden of illness that we see across the communities. As alluded to earlier as well by one of our Sangam speakers, there are significant links between the mind and the body. And I think some of these are quite well known, that psychological stress has a significant effect on things like cardiovascular disease, when we speak about heart attacks and strokes specifically, flare-ups of autoimmune illness, for example, rheumatoid arthritis. We also think about dermatological conditions, acne, those stress spots that come out that some of the children in the class or at home may be complaining about as well. And then also, quite interestingly, there's functional brain imaging, which basically is a scan that allows us to see what changes in brain chemistry, hormones, and blood flow actually contribute to how stress is managed. This is quite an important slide for me. I very much like to focus on the fact that, firstly, self-care is not equal to being selfish, and also the principle of not being able to pour from an empty cup. So I just want us to pause there for a minute and just think about that. If we are being asked to provide so much for our classroom of kids, for our teachers, the staff, we need to be held accountable, we are held accountable to the department as well, we're being pulled in every direction, but what's important to know is that if you don't take care of yourself, it's virtually impossible for you to function and serve those around you. So when we think about what are some of the things that siphon from our cup, what takes a sip, or sometimes very chaotically, what makes us spill our cup entirely, these are some of the droplets that fall out, and I'm sure that if I ask the room, there'd be a lot more answers being given. But we think about things like managerial concerns, whether they be from the department, the governing body, the staff around us. Also the academic burden, basically, that that you as educators then have to fulfill. You have to steer your class in the right direction, and also when we spoke about curriculum and so forth, it's something that definitely takes a lot of energy. You also want to focus on your learners' holistic needs, so not only the academic performance, but also the other spheres of life that inevitably come to the fore when you're dealing with a school full of children. It's not just about the people that sit in front of you, but who that child is when they have to go home and then come back to school again. And then another thing that can be quite taxing, but obviously is also very necessary, is liaison with caregivers, so the parents, the family unit. I'm sure it can be very exhausting, but obviously it's a source that needs to be tapped into if you want to look at the holistic well-being of the children in your school. So why is mental health in education so important to speak about? And firstly, I want to say that I was very lucky to work in a dedicated child and adolescent psychiatry unit for 6 months last year. And this is when I very quickly had to learn about terms that I hadn't heard of before. I had to learn about LSEN schools, about learner support teams, etc., etc. So I was working with kids with ADHD, with disciplinary problems, children that have serious mental illness as well, like schizophrenia, bipolar mood disorder. And I had to, for some patients, liaise directly with principals or deputy principals. And for those 6 months, let me tell you, I was exhausted. And that was just getting a glimpse into what you deal with from day to day. So some of the reasons why speaking about mental health and education are important, specifically, you're dealing with very vulnerable groups, these being children and adolescents that are coming through your halls every day. So just keeping in mind that they are a vulnerable population, they might not have all the life experience that we want them to have and develop, and sometimes coming from circumstances that aren't really conducive to that. Specifically as well, I have to mention the LGBTQIA community and those children that are also in classrooms that might be giving intense feelings of confusion regarding identity, and there are services out there to help provide support for that. Again, we speak about the child and family unit. I've alluded to it previously, but how you cannot teach a child in isolation. You need to be aware of what their circumstances are when they go home. But sometimes it's difficult to put those boundaries down when you have to really think about what is practically possible for me to intervene in this child's life to give them the best chance possible of having good outcomes. Then, of course, we have concerns regarding the well-being of the child themselves, obviously the academic performance and results, and there's a lot of pressure on you as educators to provide the best results possible, but also you think about things like socializing with peers. Is my the child in front of me having a good, well-rounded socialization experience? On the negative side of that, there's bullying, of course, which is something that's been around for being in our collective consciousness for decades now, and something that is really a struggle for children, but of course also the educators that the children come to for advice and with questions. We think about other things like neglect from the caregivers, from the household, physical, emotional, sexual abuse, food insecurity at home, caregiver substance abuse, and of course substance abuse of some learners themselves. It's important to say also that obviously when you are sitting in an environment where you work with children, there are inevitably things that come to mind as well regarding transport costs, school supplies, extracurriculars, school fees that the children and their families may be struggling with, and sometimes very difficult to delineate where does my responsibility stop as an educator, as a principal, because your heart goes out to the children, and it's just something that's very difficult to switch off as soon as you get home. So the next part that I want to speak about is burnout, which recently has become quite a buzzword as well, but it is something worth speaking about, I feel. So according to the ICD-11, the International Classification of Diseases, that's the 11th division, burnout essentially is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed, and it's characterized basically by 3 dimensions. One of them is energy depletion or exhaustion. The other one is increased mental distance from your job, or feelings of negativism or cynicism regarding your job, and then also reduced professional efficacy. So some of the consequences of burnout for you as an educator or for your staff, as people working to serve these children, it results basically in poor work performance, dissatisfaction. It can also result in social drift and also have an impact on both professional and personal relationships, of course. Substance abuse is something that we see quite often in the mental health sphere. People coming to us with problems of addiction or trying to self-medicate themselves due to the stresses they face. Also on a physical level, looking at metabolic illness, hormonal changes, diabetes, weight problems, hypertension, etc. And then of course full-blown mental illness, for example depression, anxiety, and also psychotic illness, and also leading to things like dementia. So we always say that prevention is better than cure, but this can be quite an abstract concept. Sometimes you don't know where to start. And what I just like to do is firstly to take a breath, and then look at the mirror, and basically have an honest conversation with yourself, and ask yourself, what are my needs? What are my limitations in the context of what my personal capacity is, what my resources look like, and also what resources and support structures are physically and practically accessible to me. You then also need to look at what are some of the aspects of personal well-being that need to be addressed in this case. So the first steps, it's basically in summary that very honest conversation with yourself where you realize that maybe you're at breaking point, or maybe you have the insight and introspection to know that before I get to breaking point and burnout, these are some things that I need to address before things get out of hand. It's also obviously very helpful to confide in someone, whether that be in a professional or personal capacity. And then also just finding help. So knowing what steps to take, for example, going to your GP or to a doctor, going to the nurse at your local clinic, finding a psychologist or a counselor, perhaps you have access in your school itself to an educational psychologist that might have resources, maybe finding a spiritual leader in your community or a community elder, and then of course also investigating what NGOs, NPOs, and possible helpline numbers are available to you. So the Circle of Wellness, it's basically a model that was designed by Augusta University in Georgia in the US. And it started off as a staff wellness program for doctors specifically, but it's very easy to see that it can be applied across all different fields and contexts. And I thought it was quite a useful model to speak about today. Again, here are some things that might be quite obvious that have been mentioned in the media over the past few years, but it just bears repeating, and it can be really helpful to just break things down to their bare essentials and start to build yourself up here. So the first thing is physical well-being. And basically that means optimizing your physical functional ability. So that's addressing physical health concerns, essentially to limit the effect that they then would have on your mental health. That requires looking at your dietary and nutritional elements, looking at what you're eating and consuming, and how that affects you from day to day. I also need to speak about adequate sleep and rest, and sometimes it's a case of quality over quantity. And that's something that we call sleep hygiene. It's not just about getting a nice bath or shower before you get into bed, but basically about the way that you train yourself to get into a routine to get more effective sleep rather than just a longer duration of sleep. Then a lot has been said previously about endorphins and exercise. Basically, these are results of a positive stress response. So that happens when you perform exercise or physical activity. It basically helps to, studies have shown that it helps to inhibit pain. So people that suffer from chronic pain, obviously according to their specific limitations, physical activity in one way or another does sometimes help produce endorphins, which can help limit the pain response. And then also it works on our neurological and biological reward pathway, working with dopamine and serotonin and so forth. What's quite exciting is that there's been a lot of research done in recent years speaking about the way that physical well-being and specifically nature or green space itself has a positive effect on the person's mental health. There's several studies, and what's quite exciting is it's not happening here yet, but hopefully one day soon. But doctors in Canada can basically write a prescription for their patients to spend some time in a national park or an outdoor space. I can certainly speak to my own since I've started exploring the more and spending more time outside and outdoors, the fresh air does some wonders. Whether that's going for a swim, some salty water, going for a walk, and just taking in a good view, that in itself can be a really undervalued experience that you can not exploit, but can utilize it. Then, of course, we have social well-being. That's creating and maintaining very meaningful relationships. And, of course, the definition of meaningful varies from person to person. And we, of course, have to speak about the personal and professional relationships, and very notably the boundary between them as well. Oftentimes it's maybe easier to confide in a fellow colleague, and sometimes speaking to a family member may be easier. Social well-being in the form of boundaries is very important as well. We think about putting structures in place where we can, as far as possible, leave work at work, and when you go home, to be able to switch off to a certain extent. That's easier said than done. Especially during COVID, where a lot of the work was done from home, just having that physical barrier disappear about having to leave your home to go to school or to go to a meeting, having all of that happen at home, it really mentally does take a toll. So trying as much as possible to put implementable things in place where you can distance yourself from that physical workspace. Social and support structures, so things like groups, clubs, hobbies, activities, whether that's a photography group or bird watching or a knitting and crocheting group, whatever it may be. Try to just reconnect and reflect on what some of your interests were before you got so befuddled by the work that's lying in front of you. What are some of the things that really brought you joy? Then, of course, we can't speak about social well-being without speaking briefly about about social media. So that's just about limiting our expectations about what we expect when we post something online. What are some of the repercussions that can happen, and trying to safeguard that distance you put between yourself and your social media presence. Intellectual well-being, something that you all are very focused on, in the direction of from you to the learners in front of you and to your staff, but also looking at your own intellectual well-being. So that would be focusing on stimulating thoughts and interests. Again, like I said, reconnecting with some of those old hobbies that you might have enjoyed at one time, once upon a time, and trying to not forget that. Balancing your intellectual well-being with rest and relaxation, as we know that they're very deeply linked, even though we often forget, and those lines become blurred. Creativity, that's why we see things like adult coloring books coming into fashion and becoming a new trend as well. Just because it's something that we get to the foundation phase learners doesn't mean that that's not something we can benefit from as well. It all revolves around critical thinking and problem solving. As was mentioned earlier this morning, it's very often about how we get to the answer rather than the answer itself. And just performing that mental gymnastics in itself is something that can stimulate our intellectual growth. Active participation in hobbies and interests, like I mentioned, and then trying something new. Maybe stepping out of your comfort zone, maybe getting one of your kids to invite you, or one of your kids at home, invite you to one of their interests or hobbies, and maybe exposing yourself to something new. Occupational well-being. I think we're all too familiar with the to-do list and the checklist that we have to get through every day. But basically it's about recognizing and reigniting passions and skills that you have. Not forgetting that you have the skill set that you gain to your position and holding, and that it really is something that you can tap into even when you feel like it has been depleted for such a long time. That comes again to refilling that empty cup and remembering that you have all these resources and skills that you can bring to the table, and that you can indulge in with the people and the staff around you. Building, and in that same way, you can also build strong professional relationships. Importantly, knowing when to ask help. I think that doesn't stop when you become a leader or step into a leadership role. So knowing when to ask help definitely fosters that feeling of being a formidable leader in your position. Again, as I mentioned, that awareness of your workspace, the built environment, I think often it can be very easy to get bogged down in the cracked plaster at the front of the school, the paint job that needs to be done, or the roof that's leaking. But remembering that this physical environment that's around you, the whole structure of the school itself, it's something that needs to be borne in mind, whether that's decorating the classroom or investing in a garden or something. It does things for people's mental health. Being able to walk into a place that, as far as possible, as the budget allows, can be something that's pleasing to look at to a certain extent. Again, I mentioned the professional boundaries, trying to work at work, and trying to find manageable ways of doing that, and not having these high expectations of something that's not really implementable. And balancing productivity and wellness with longevity. I think we focus so much on being productive. What did you do with your weekend? Oh, I did this, I caught up on this work. But also remembering that you can't just burn full all engines at once. You need to also have that longevity that we want to work on careers and we want to be able to give to others. And it's about focusing on small joys. On having a nice cup of coffee at tea time or at lunchtime, about listening to your favorite radio station or song on the way to work, just finding those small times that you can beacon off for yourself and not get swept up in all the requirements that your day has for you. Spiritual well-being, so whether that be in a temple, in a mosque, church, or the outdoors, as I mentioned before, it's all about fostering the capacity for meaningful and purposeful impact. And I think that often gets lost in the day-to-day as well. And whichever religion or spiritual practice you may have, it boils down to teachings founded on values of respect and tolerance. And that's really what we need to keep in mind as well when we're working with such a broad range of people from different walks of life. So thinking about what support structures and what guidance is available to you in whichever spiritual community you reside in or choose to reside in. And then also that sense of community and understanding when sometimes it feels like it's lacking in other areas of your life. Financial well-being, I will very quickly gloss over because you've all got a nice masterclass in finance this morning. But basically just things like setting financial goals, planning ahead, living within one's means, and then also balance between wellness, health, productivity, job security, and financial stability. Emotional well-being, this is really what the crux of the talk is about. So it all starts with acknowledging and processing the thoughts and feelings that you experience. Sometimes it's just clouded chaos going on in your head and you don't really know what the first things are that you need to be able to slow down and reflect on what your needs are and how you can practically look at ways of going forward. So it's how we relate to ourselves before we think about how we relate to others. So in psychiatry and psychology, we've got concepts called transference and countertransference, and basically transference is about what other people are able to project onto you, and countertransference is what that elicits within you. So for example, I might have a very difficult, I'd say maybe a very annoying patient that comes into my office, and I take a breath to think, why is this patient annoying me so much? I've seen 3 other patients this morning, and no one really had the same, evoked the same emotion in me. So what is it that I'm recognizing in this patient that I might actually not want to recognize in myself? What are some of the things in my past, and my experience, and my histories that are causing me to have this specific response to a patient? And I think it's very useful when we have those kids in the class that are disruptive, just reflecting on why are you reacting the way that is being experienced here, and trying to think about what the background is of the child in front of you and what your background is. And it's all about honing a new skill set. And that's why I like psychiatry. When I was a medical student, I wanted to be a surgeon, which most would argue is the complete opposite of thinking about your mind and your thoughts. And that's what really intrigued me about psychiatry and mental health. It's about learning a new way of describing things, about looking at things, and using a different language. So basically that speaks to my next topic, which is mindfulness. So I want us to all try something together. I'm not going to take much time, but if you could for a minute just put your notepad down or a pen, and I just want you to find a comfortable sitting position. Just maybe readjust yourselves. Both feet on the ground. Preferably spread apart, next to each other, and your hands can rest either palms up or palms down on your knees or your thighs. And I'm going to invite you all to close your eyes if you'd like to. So basically, we're just going to do what's called a body scan. So let's start from the top. You can start from the bottom, from your toes as well, but let's start from the top. So it's going to be about staying quiet and about listening to what's going on around us. Hearing the traffic outside, hearing your own breath or the breath of your neighbor. What does your face feel like? Is there a frown? Do you have a smile on your face? Going to your mouth. What is your mouth doing? Is your tongue touching the roof of your mouth? Is your tongue nice and relaxed? How do your lips feel? Are they tight and pursed? Are they relaxed? Same thing with your jaw. Are you biting down on your teeth? Or are you keeping your mouth slightly ajar and just breathing slowly? Breathing. Deep breath in. Deep breath out. What does that do to your shoulders? Become more aware of your shoulders, moving up and down with each breath. You can then move down to your tummy. What's your tummy feeling? Are you a bit nervous? Feeling a bit anxious? Becoming aware of the seat that you're sitting in. What does your bottom feel like in the chair? Is the chair comfortable? Is the seat a bit too hard? Do you need to shift and adjust your bottom? What does the ground feel like? What does it feel like when you move your feet from side to side on the carpeted floor? So all of these things, you can open your eyes again, thank you. All of these things are what we call mindfulness, and it's quite different from meditation, as I put up in the slide. Meditation is often what we think of when we try to calm down and relax, but essentially meditation is about clearing your mind, about not thinking about anything, whereas mindfulness is actually fostering that awareness of what's happening around you. So you absorb using all of your senses, and what we do is, what I mentioned there is called a body scan, so you go through most of your senses. You can either work from the top down, or the bottom up, and basically it helps you to become aware of your surroundings. And it's something that has kind of esoteric origins in Buddhism and in Hinduism, but lots of studies recently in Western medicine have shown that it can help to address certain things like anxiety or just feeling overwhelmed and significant stress from day to day. So all you need basically is some time to yourself, preferably a quiet space, and basically just run through that system yourself. And basically what it does is it helps you take ownership of your body. And it basically helps you to reclaim your body and your senses, and it helps you focus in the now. So we're always worried about things that happened in the past, we worry about what's happening in the future, but this just helps us to focus on what's happening right now. And then from there, inevitably, we need to move forward. And how we do that is by doing small, achievable steps in the moment, from moment to moment. And one step at a time, going closer to what the goals are that we set out for ourselves. As I mentioned, the first steps again, it's something very important to be aware of and not to underestimate. So being honest with yourself, having the confidence to speak to someone, finding help, whether that be a healthcare practitioner, a spiritual leader, a counselor, psychologist, etc. And from there, these are just some hotline numbers that I'm sure you'll have access to when you get the presentation, or you can take the picture now. But basically, these are some resources that I often give to my patients, essentially just to give them that helpline of the first step. This is a person I can call.